My name is Craig Lankford. I'm one of the conservative care physicians at Texas Back Institute. My primary specialty is physical medicine and rehabilitation. My primary passion as a kid, I really enjoyed the sciences, and so that was something I was always very interested in. My primary specialty is physical medicine and rehabilitation, so its primary focus is on patient physical function. So the ability to accomplish functional things of daily life, what we call your activities of daily living, getting dressed, preparing your food, household chores, moving around. And so what fascinated me more than anything was one of the first experiences I got was just a physical therapist working with a stroke patient. When I was straight out of high school, started out, they had us kind of just doing a shadowing program at one of the hospitals, and we went over to the physical therapy unit. Like I said, they were working with this a patient that had a stroke, and through the process of time as we saw this patient, really seeing them recover function on the side of the body that had been affected by the stroke, that really was profound. And at the time I had never even heard of physical medicine and rehabilitation as a primary specialty, but when I found out that that existed with my interest in kind of physical therapy and physical function, it really kind of became apparent to me that that would be the primary specialty I'd be very interested in. I came direct to Texas Back Institute. There was a colleague of mine who graduated straight out of residency and came to work for Texas Back Institute for conservative care. And then at the conclusion of my fellowship, through him, I gained employment with Texas Back Institute. So I kind of consider myself as part of that multidisciplinary aspect of treatment. Patients with spine care, it's a multifaceted approach. It really requires a team approach to care. And so we incorporate physical therapy, psychology, surgery, injections, pain management to try and achieve the best outcomes for patients. And so I just consider myself as part of that team to try and help patients. I've practiced now for going on 12 years, has been more and more directed towards patient education and really trying to help empower patients to try and be able to manage what can oftentimes be a chronic condition, which is back or neck pain. But patients, the majority of patients are more than capable of being able to improve their level of function and decrease the amount of pain they have just through some basic lifestyle changes, weight loss, exercise, focusing on the problem to take care of their back and neck and to improve their quality of life. Currently, my hobbies are my family. So I've got 3 boys. Our kids are typical boys. They're rough and tumble. They like to play outside. They like to play sports, they like the rough house, and they're very active kids, and so we try to take advantage of that. I think one of the primary things I'd like my patients to know is that we're here to try and help them understand their pain, understand its effects on their life and how it's impacted their life, and that we're here to try and help them overcome those issues and to try and improve their pain and improve their function as much as possible.